Hi everyone, welcome back to the channel. This is Drew here with Let's Talk Something. And today, as you can see from the title, I'm going to be talking about the coronavirus. But before I get started, I would just like to ask you, like, share, subscribe. Don't forget to hit that bell icon and leave all your comments down below. Now, in this video, I'm going to be talking about what I think about the preventing the spread of this virus, and why I think, as Dr. Oz and other health experts are saying, to wash your hands, and why I believe that washing your hands just is not enough to prevent the spreading of this virus. Why I don't believe it's going to work, much less I don't believe it works for any other virus, even the flu. And I'll give you my opinions and my reasons behind my thinking about that. But before I do, I just want to read up on the current events in about the coronavirus, which was just updated maybe about an hour ago. Um, Here's my phone right here. So let me read you. This is from the New York Times. The mayor revealed that 2,733 people are under quarantine in the city, as officials said 11 new cases have been identified in the state. Now, the state that I'm in right now is New York City, in New York State. I'm actually in the Bronx. And so there was 11 new cases just yesterday alone. At the time of recording this video is actually Friday, February 6th. This is about, I'm not really sure the time, but it should be somewhere. Oops, my phone is right here. It's not, right now it's 4:49 a.m. in the morning. 11 new cases, bringing the total number to 22 confirmed people infected with the coronavirus. There were 8 cases in Westchester County, 1 on Long Island, and 2 patients in New York City who are critically ill. The City Department of Health is keeping tabs on 2,773 New Yorkers currently in home isolation, most of them in self-quarantine, city officials said on Thursday. Most of those under self-quarantine have recently returned from the 5 countries where outbreaks have been most severe: China, Italy, Iran, South Korea, and Japan. The New York City Health Commissioner said, as of February 5th, the death toll has climbed to 12, with 225 confirmed cases across the country. So it's rapidly growing. This thing is rapidly spreading around the world. There were more than 98,000 cases and more than 3,300 deaths. So, and I believe I read earlier today too, over 5,000 or so people has actually recovered. So it looks like the recovery rate is much higher than the death rate. Now, the mayor, the governor here in New York, and even the president saying that they have this thing under control, which I don't believe that is true. From what I'm seeing, from all the for how fast this thing is rapidly spreading, the president wasn't so worried about it. That I believe he even put Mike Pence in charge, if I'm correct. I'm not really that into politics. From the time I heard, I'm like, how can you have it under control? How can you be prepared for something that you're not even sure how it's even, you're not even that sure how it's being spread? And the things that they've been saying don't make me have confidence in that, because at first they said when you come in contact with the virus, you will start seeing symptoms in 2 days. Then there was another report that now it's 2 to 4 days. Then another report, 2 to 8 days. Then as recently as yesterday, according to what the CDC said, is 2 to 14 days. And I'm not even sure they know how this thing is actually spreading. They're not sure how you can get it, because before they were telling people to wear masks. So now everybody is buying masks, and these masks are made in China. Just Tuesday here, I was on the train taking my daughter to her doctor's appointment, and I saw a few people on the train wearing their mask. And I'm looking, I'm like, this thing is not, that mask is not gonna work, because these people wearing their mask, they're constantly touching it, adjusting it. This one guy ran his wired headphones through it into his ear. Maybe I'm missing something here, but this can get germs too. These wires can have germs. Nobody actually cleaned these things. Then yesterday, February 5th, in the news, I was watching the news when the doctor was there. He's basically saying the same thing, that the people who should be wearing the mask is the people who are infected, the people who are sick. They're the ones who should be wearing it, because fluids from their mouth doesn't go anywhere, because that's how the virus is being spread. Somebody have it, they touch something or they sneeze and their fluids land somewhere and you touch it. I could be wrong about this, but I believe they said they wasn't sure if it goes through your skin. So that's also why I believe they don't fully have a hand in this, and I really don't have faith in them when it comes to this having it under control. Now, as they said they will not have a vaccine for this for about a year. So that's a long time, and as fast as this thing is spreading, that's a long time. Now I'm going to give you my opinion why I think washing your hand thoroughly, like you're supposed to, because you're supposed to wash. I've worked in food industry, and you're supposed to wash your hand on the warm or the hottest amount of the hottest temperature that you can handle on your hand, with soap, and make sure you scrub. Try and get us under your nails and stuff like that, for 20 seconds. So this is something I already know. Now, why I believe that won't work, because there's things that we do that puts the germs right back on our hands. Why I think that it defeats the purpose. And yes, you should wash your hands. I'm not saying nobody you shouldn't wash your hand, but there's things that we do that defeats the purpose. So now just think about it. You come home from work, you're worried about the coronavirus, about the outbreak. You're worried about getting any kind of about catching any kind of virus. Maybe you order food. Maybe you came home with a box of pizza. And let's say you came home with a box of pizza, or you buy something from the store in a bag. Now you're holding the bag. You just come off the train or whatever, or where you've been out in the world. You're touching things. You actually touching the pizza box. I remember other people's hands don't touch that box. You put it down, you wash your hands thoroughly, you touch the box to open it to get that pizza, or touch that bag to get the food out of there. You just put the germs right back onto your hand. I mean, you're not going to have as much germs, but if somebody had the coronavirus that actually touched that box, you're basically touching it back. You're basically putting it right back. You're basically in contact with the virus. Here's another reason. Here's something else. Because you can clean your hands all you want, but there's something else that we don't clean. You open the box, or you get your food in your fridge or whatever. You wash your hands. You get your food. You're sitting down. Now we all live in the technology age, and you should get where I'm going with this by now. You sit down on the table, and we all do this one thing, and I'm guilty of it. No matter how much I wash my hands, we never wash this. We pick it up and we sit down and we eat, and we have this in our hands. We pick up the remote. We do not clean the remote. You be at your computer, your desk, whether it's at work or at home, your tablet, whatever. You don't clean it. We don't clean these devices. We should, but we don't. I mean, I'm guilty of that. If I remove this case right now, you'll see grime and stuff under the case. This germs and stuff that's living on these things that we don't clean. Wherever you was in public, you're touching this thing, and the virus is on you. You touch wherever it was. You grab your phone. Now it's on the phone. You wash your hands. You pick up the phone again. Right back there, that's where your phone is. What about your door handles? How many of us truly actually clean our door handles? You might have touched the person. You put your hand in your wallet, maybe to pay for something. Now it's on. All that germs, all that fluid that you touched on is now on your wallet. It's on your credit cards, your debit cards. It's on your keys, and there's a lot of things we go out in the world and we're touching and we don't clean them because we don't think about cleaning them. So that's where I was going with it. That's where I think, it's hard. It's hard to not spread this thing. And the MTA, from what I'm seeing here in New York, the MTA is trying to clean up all these trains, but they can wipe these trains down. These trains go stop to stop. So they could wipe it down. Somebody could come in it that has the virus or any virus, and they're touching and sneezing and coughing and everywhere. I've seen homeless people pull their pants down and wipe themselves on the poles, on the seats. I've seen them lick the seats, lick the pole. I've seen a lot of things. I've gone on the 2 train and seen feces all over, even on the ceiling. I don't know how it got there, but I've seen things like this in the MTA system. So how are we supposed to stop the spread of this thing, of these viruses, and especially the coronavirus, when there's so much factors that goes into staying clean? Unless we're just walking around with hazmat suits and gloves on, we not coming in contact with anybody or anything. But that is just my opinion on this whole thing. If you think I'm wrong, just leave a comment down below. But that's it for this video. I am Drew, here with Let's Talk Something. I'll see you in the next video. Peace.